welcome. So remember when I said we had a very, very special guest? Well, voila. Here's our special guest, and I'll have him introduce himself and teach us a thing or two.
My name is Seth Lawrence. I am a physical therapist at Results Physiotherapy, and the doc was telling me that she was talking about Achilles Tendonitis and wanted us to show you some things that you can do at home to try and help.
Yes.
So I'm sure she explained Achilles tendonitis is inflammation within the tendon, and oftentimes muscles that attach to that tendon get tight and start constantly pulling on the tendon. So we have to relieve some stress off of the tendon. So we're going to do a couple of things. One, we want to do some self-tissue massage or some self-massage. So we can do that with a foam roller. All right?
Awesome.
Can you be our client today? So
of course.
Those are beautiful shoes.
But
Kick them off right here. And what I want you to do is sit right here on the ground.
All right.
And you're going to put your calf on this thing.
Okay.
Yeah, there you go. So then what we can do to make it more aggressive, we can try and cross one leg over the other.
Wow.
Okay? So, and what you'll do is you'll just roll up and down on your calf. You'll have to use your arm strength a little bit.
So
Just lift yourself up a little bit and then just kind of roll up and
Whoa.
down. Yeah.
This is a shoulder workout.
Yeah, it's a shoulder workout. But what we want to do is we're looking for knots and adhesions and buildup in tissue that isn't pliable and flexible. So what we want to do, think about.
I have a question.
Yes, ma'am.
How far do I have to roll? Do I have to roll all the way to my heel or just my muscle, like just my calf muscle?
So the calf muscle, one of your calf muscles crosses your knee.
Yeah.
And so we want to roll to the knee, but
Okay.
not behind the knee. You've got a lot
Okay.
of blood vessels and things like that you don't want to mess with. So you want to roll all the way from the knee all the way to the Achilles. You go. So let me show you. So once you find a good tender spot, go ahead and set your body weight down, and then you can just kind of go side to side across the fibers, and that's just more aggressive.
Okay.
You can kind of come up and down and just oscillate on one little spot.
Okay.
Once you find a tender spot, that's where you need to do it. So don't avoid that spot. Okay? Cross
What if
this
it
leg
really
over.
hurts?
If it really hurts, you're doing it really well.
Okay. So guys, you hear that?
That's right, that's right. This is tough love that I don't apologize to my patients about, because they're gonna feel better when you get off of it.
Okay.
All right? Our love hurts is what we like to say.
I love
Okay?
So I cross.
So
Okay.
you can cross over to make a little bit more, make it more aggressive. Okay? And then again, you'll work your way up and down the calf, up and down the back of the lower leg, so that you can find these tender spots. That's a good pain face. We like change face, not pain face. But then once you spend some time on it, then move to the next spot. Maybe move down just a little bit, there you go, and then pick the next spot. Okay? You want to work your way, you want to knead the dough. Just like anything, if you work tissue, it becomes more pliable and more able to work.
This is interesting. I never knew this exercise. I've heard about it, but not, like, I didn't realize it was this intense, I suppose.
Yeah. So there's a couple of things. This is mobility, and a lot of people will get the concepts mixed up. Is it an exercise that causes strength? Is it a stretch that increases flexibility, or is it a massage that increases mobility? So there's a lot of different things that you can do with therapy and to help with the tendonitis.
Awesome. Sounds good. Well, thank you. So what else do you have for us?
Okay, so once we manipulate the muscle and we make it more loose and pliable, we want to try and stretch so that the muscle's not pulling on the tendon all the time. Okay? And what we'll do is, here in the clinic, we'll use a slant board. So what I want you to do is, excuse me if I turn my back to you, you're going to keep your heel on the ground and keep your knees straight. Okay? And I'm going to talk to him a little bit more about this while you do that.
And is this something we can get online?
You can get these online, but you don't need it. So I'll show you something different as well. So keep your heel on the ground, keep your knees straight, and then just lean your hips forward. There you go, until you feel a good, comfortable stretch.
Yeah, that's actually really good.
So we talked about a couple of different muscles back here, both attached to your Achilles tendon. One is called your gastrocnemius, and it crosses the knee, and that's why you want your knees straight when you're doing this, so you can really get a good stretch out of it. If you wanted to squeeze your quad while you do it to really extend your knee, then you can do that as well.
Ooh.
The other muscle back here that attaches to your Achilles tendon is called your soleus, and what we can do is we can inhibit your gastroc by bending your knee, because the soleus does not cross the knee. So come off of the stretch just a little bit. There you go. Yep, and now bend your knee.
So am I still putting this on?
Yes, ma'am. Yes, ma'am. You're doing good.
Bend.
And then bend just a little bit. And so you'll feel this kind of further down, as opposed to like a pure muscle belly stretch. You'll feel a tightness in the front of your ankle, or kind of just more of a tightness in the bottom there.
Okay.
So stretches we like to hold for about 20 or 30 seconds, and then the foam rolling you want to do for about 3 minutes, 4 minutes.
3 minutes?
That's right, that's right. Yeah, it takes all day to get tight. You gotta put some work in.
Oh my goodness.
Yeah.
So can we take breaks in between?
Absolutely, absolutely.
Because that could be quite painful.
So here's the other thing. If you don't have a slant board, let me move this out of the way. A lot of people have seen this. It's just a runner stretch. So you can use a table or a counter or a wall.
Okay.
And you're just gonna hold on and then just put your foot back like the old school runner stretch. So same thing, it's the same stretch. The slant board is just a little bit more aggressive. So I'm sure you feel that. It's just not quite as aggressive.
Yeah. All right, so what else do we have to do as far as exercises at home?
So the foam rolling is mobility, and we want you to stay on the foam roller for about 2 or 3 minutes, 4 minutes. You got to take some time to knead the dough to make the tissue more pliable.
Oh, wow.
Okay?
2 minutes, okay.
2 or 3 minutes. What we want really honestly is for it to feel better when you get off of it than when you got on it.
Okay.
As you noticed, it was quite intense, so as you loosen things up, it should start to feel a little bit better.
Okay.
So spend some time getting loose because we spent all day getting tight.
Oh, that makes sense.
Right.
That actually makes sense. Okay.
So we can follow the mobility with some stretching. And this
Okay.
is a slant board that we have in the clinic. Not a lot of people have this, but we'll show you a couple different ways that you can stretch with it.
And is this board something you can get online?
It is.
Or for ourselves? Okay.
Yeah,
cool.
absolutely, absolutely. But again, this will be a little bit more aggressive, but you don't need a slant board. So
Okay.
you can absolutely buy one if you need it.
All right.
So what I want you to do is I want you to put your heel on the ground and your toes on the board.
Like that?
There you go, a little bit further. So just your heel is kind of hanging on.
Okay.
All right, I'm gonna raise the table up so you can hold on to this. So just kind of shift your body weight forward, and then you'll start to feel a good stretch
Oh, yeah.
in the lower leg. Now we talked about 2 different muscles. One crosses the knee, so if you wanted to really get more aggressive, you can squeeze your quad muscle to help straighten the knee.
Oh, wow. Yeah, that actually does help make it tighter.
Yeah.
Make my gastroc tighter for some reason.
Yeah,
Interesting. I didn't
yeah.
know that.
So because the gastroc crosses the knee, it also attaches to your Achilles. We have another muscle that doesn't cross the knee called your soleus. So in order to inhibit the gastroc, we need to stretch the knee, or excuse me, bend the knee
Okay.
so that we can stretch the soleus. So move your foot back just a little bit. There you go. And now just kind of sit down into your knee. Just drive your knee towards the ground. There you go. Now a couple of things you want to think about. You want to keep your foot straight, and you want to make sure that your knee doesn't fall in, right? You want to keep your knee lined up with your toe.
Okay.
There you go.
What happens if we're tilted one way or the other?
You just start to stretch different portions of the fibers,
Okay.
and you want to stretch the whole muscle equally, really.
Okay.
So, and we don't want to put any extra leverage on any joint that we don't want, okay?
I do feel that stretch. Now I have to do it.
Do the other one.
So I can balance.
Line it up, line it up.
All right.
And so we talked about you don't have to have this slant board in order to stretch. So let me take that away from you. And now what I want you to do, it's a good old-fashioned runner stretch. So hold on to the table and push one foot back. There you go. And it's just like, there you go. Balance it out.
Well, yeah.
So same thing, knee is straight, heel stays down on the ground, squeeze your quad so that you can increase the stretch there. And there's your gastroc, the one that crosses your knee.
Okay.
And now relax there and slide your foot forward just a little bit. There you go. Now bend your knee and kind of sit down into the heel. And that's the same thing. And you can see her knee's a little bit more bent because we have to take up more slack because we don't have the slant board.
The slant board is definitely much more aggressive. I like that better.
Slant board's the way to go. So a lot of people are telling me how much do they want to stretch, or asking me how much do we want to stretch, do we want to feel pain? And
Yeah.
my answer is always no, you want to stretch to the pain, not
Okay.
through the pain.
Okay, so if it's acutely inflamed, just do it till like tolerable, I suppose. And if you can't, just back off a little bit.
That's right, that's right. Tolerable,
No.
not even to tolerable. You
Oh, okay.
want it to feel good, right?
Okay.
You don't want it to hurt because it's already inflamed. There's already inflammation within the tendon. So it's almost like you're nicking a scab, right?
Okay.
You want to go to the pain, not through the pain, so that you can listen to your body and you can heal, not make yourself worse.
Awesome, awesome. Well, there you have it.
Okay, so after we mobilize
Uh-huh.
and make the tissue more usable, the
Okay.
tissue being the muscle, then we stretch to kind of line up the fibers and create length in the tissue so that we can have a full range of motion. Now we want to support that range of motion with strength.
Okay.
And we've all seen these before too. It's just calf raises.
Oh.
We want to address both muscles that attach to your Achilles tendon. So the more obvious one is go ahead and hold on here for me. And then you're just going to get up on your toes.
Oh.
So get up on your toes, and it's the muscle squeezing like this, pulling this heel up this way.
I should show off my calf, just so y'all see how hot it is.
Popping through the bottom
Oh,
of your pants there. So we're gonna go up and down, and we'll just go through, 3 sets of 20 is a good number to start with.
Ooh.
Now with the tendinitis, it could start to get a little bit aggressive. So what we do as we progress, we try and use a muscle contraction called an eccentric muscle contraction or a negative. Okay, so when your muscle gets more dense like this and contracts, it's called a positive muscle contraction. When it lengthens, that's when it's the most strong, I guess, so it's called an eccentric or a negative. So with this one, what we would want to focus on is on the way down. Okay, so let's say you have pain in your right foot. All right, so you're going to go up with 2 and then down with 1, nice and slow. There you go. And
all the way down?
All the way down. And then you come up with 2. There you go. And down nice and slow on the way down. So you're focusing on the way down where the muscle is lengthening.
Oh.
Yeah, so that particular force tends to perfuse blood to the muscles and the tendons. So it has shown to heal a tendinitis.
Awesome.
Negative muscle contraction.
See, from the expert. I didn't even know this at all. That's why I wanted to have the expert just kind of talk to us about this and things you can do at home. I mean, wherever you are around the world, if you have Achilles tendonitis, listen to some of these things he's saying. It's pretty amazing.
That's good stuff.
Yes.
We got one more thing to show you. Go ahead and sit down there for me.
Okay.
So with this one, you might have seen these machines in the gym where you have weight on your leg, right? But we can start, again, acutely. If you're in an acute situation, then we just want to do the same thing. Just raise your heels off of the ground.
Okay.
Now you just have the weight of your legs with this, and then it'll come straight back down. So now we're working your soleus, the muscle that doesn't cross the knee, right? Because the knee is bent. So we're isolating your soleus a little bit here. Now sometimes you'll have to put a weight or a water bottle, whatever it may be, on your knees, and you can progress this way.
Because this is not as challenging as, the other one, so.
Correct, yeah.
Okay, so put a weight on. Okay.
Yeah.
Weight on it.
So there's 2 strengthening things that you can do for your Achilles tendonitis.
Awesome. Okay.
Yeah.
Well, that's nice. Good. So these are some of the things that we can do at home without, we don't need help. We don't need anyone else for these. Okay, well, that's awesome. Well, if you have any questions, concerns, any tips, if there's anything else that you've been doing and we didn't mention it here or he didn't mention it, leave it down in the comment below. He works with one of the most awesome physical therapy places that I know around here. He gives excellent advice. So follow him on social media. What's your social media?
Life.prescribed.
Okay. All right. So awesome. Check him out over there. Any last or final words or anything like that for us?
No. Thank you for having me. I appreciate it.
Oh, well, thank you. Thank you so much for this free 99. Free 99 awesome advice. You can't get it anywhere else from someone who's awesome and also awesome to look at. We thank you guys for joining us today. If you have any questions, again, leave it down below. Don't forget to subscribe, share this video with those who may have issues like that, and we'll see you later. Bye-bye.